Daines.
Thank you, Madam Chair. I just want to start by recognizing Brittany. Very proud of you. I just came from a hearing down the hall with 7 generals and admirals sitting at a similar hearing table. And the courage and poise for you to sit there is to be commended. And as a father of 4, a daughter who just got an elementary education degree like you did, very proud of you, and best of luck to you as you start your career in elementary education. Thank you. In Montana, one of the challenges we face certainly is homelessness in rural America, because you have a combination of sparser resources in Montana, colder winters, and we're seeing youth homelessness is on the rise. In fact, in September of last year, KTVH, a local Montana news source, cited that for the 2012 to 2013 school year, the U.S. Department of Education claimed that enrolled homeless students had increased by 45% in Montana. The good news is Montanans are compassionate people, and they've got a big heart. That spirit of generosity has allowed the Great Falls Rescue Mission in Great Falls, Montana, to operate 100% on individual donations and the providing housing to 22 children, with plans to expand housing to 70 children with a new $7.7 million addition. Jim Kaiser, who served as the executive director for over 8 years, explained they've been doing that all without any federal, state, or local government funding. So, I'm a supporter and believer in what we're doing here in terms of supporting efforts to address homelessness, but I also think this public-private partnership is so important as we go forward. Ms. Ho, how does the plan that you're considering weigh the inclusion of charitable organizations in solving youth homelessness?
Senator, thank you so much for that question, and thanks for your commitment to this issue. It's very much appreciated. I ran a nonprofit for 11 years. Debbie's run a nonprofit for 40 years. Congratulations on that, by the way. Cindy's got the foundation. You can't do systems change and scalable work to solve this problem if you can't figure out how to piece together funding from many different sources. And I think that what you see here is the strength of collaboration between nonprofits, philanthropy, the federal government. We also work very closely with state and local governments, but also being informed all the time by the experience of people who have been there. So this is about everybody pulling their weight and leveraging the federal investment. But I think that what we are learning at HUD how to do better and better every year is to be very strategic and very targeted in terms of how we ask communities to use the money that you appropriate so that we can actually get our heads around a systems solution that has better data, better performance measures, and the potential to actually solve the problem instead of just having a bunch of individual providers that are all doing good, but not having a sense that this is something we can
I appreciate that. And I want to build on what Senator Cassidy was, and Madam Chair was addressing, was this issue sometimes of getting through the legal hurdles here. Jim Kaiser, who directs this rescue mission in Great Falls, explained, and I quote, he says, "There's much in the way of legal problems that keep a youth from seeking housing. Our policy is to contact the Department of Public Health and Human Services prior to housing a youth, as they have the legal authority to place and direct youth care. If I housed youth without their consent, there could be legal consequences for the rescue mission." Ms. Ho, I know we're trying to strike a balance here between the safety of the homeless youth, which has to always be of the highest priority, but also with legal hurdles that can keep nonprofits, such as the Great Falls Rescue Mission, from helping them. What are your thoughts, and how do we address that issue?
Thank you, sir. We've been thinking about that a lot, because I think that when you look at HHS's programs and HUD programs, you have some HHS programs that are targeted specifically to the under 18, the minor youth. But then you have a state overlay of mandatory reporting requirements or maximum lengths of stay. Those aren't our rules, those are state rules. But how can you work with a young person who needs it for as long as they need it if you have that overlay? On the flip side, with HUD's housing programs, we're designed for someone to have a lease. Only an emancipated minor or somebody who's reached the age of 18 is allowed to hold a lease. And so, our programs aren't always set up well in that. Now, obviously, in emergency shelter and other situations, those same rules don't apply to the HUD programs, but the state overlay around what to do with minors is in play here. So I think that if we are going to get to a system where there's a safe place for every young person to stay and a clear path forward based on their needs, that works kind of on the timeline that they're on and not some type of 3-day, 5-day, 14-day overlay, that this needs to be a dialogue that really starts with a vision that shows what's broken in the way things work today and what a better system would look like.
Yeah, and I think the partnership is demonstrated right here on this table here in terms of we've got public and private. Ms. Shore, do you have a thought on that as well?
What I would say is that the Runaway and Homeless Youth Act, which allowed us to create wonderful programming for young people, very much geared to young people, allows for a 72-hour period where we don't have to have parental permission unless the state changes that, so that we can assess what's going on. And after all, we're mandatory reporters. So part of that assessment is this something that we should be more concerned about, Ray, abuse, neglect? Or is this something where we can work with the family and we are very family focused? And I think that that is a really important sort of system to protect, because I think it really helps us to make sure that we're doing the job with young people and allowing them to come in and get safety while we figure out what's going on. And I just want to say that in the vast majority of cases, we are talking about young people where we call the family within a very short period of time. We don't usually take the 72 hours, but it allows for the legally that we are protected at offering that space for a young person so that they can be safe.
Okay, I'm out of time. Thank you for standing for the dignity of every human being, especially those who are most vulnerable. I appreciate that.
Thank you very much, Senator, for your participation today. Britt.